My friends, if a patient can receive care at home, we should do everything we can to support that. Today's investment will not only take care of pressure off the hospitals, it will also allow patients to receive quality care from our dedicated nurses and personal support workers outside of a hospital. That's critical right now with the deadly threat we face with COVID-19. We know our most vulnerable are safest, where possible, in the refuge of their own home. And it's not just a short-term fix. Better home care means a better healthcare system as a whole. If a doctor can check in with you virtually, if you have a nurse visit you after your operation and help you recover sooner, this new approach is game-changing, my friends. Today's funding also includes $14.5 million to expand virtual care across the province. This funding will ensure healthcare providers can provide quality care to patients in their homes virtually. This will also benefit patients in rural and northern communities where access to care is a challenge. We're delivering better care in a more convenient and safer way, where and when people need it. As Premier, that's exactly why I was elected, to end hallway healthcare, to support our frontline heroes with the tools and resources they need, to build a system that puts the patient first. Working together, we're not only building a stronger but more connected healthcare system today. We're building one for tomorrow, for our children and their children, because our seniors, families, and patients deserve nothing less. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. No one wants to spend more time in the hospital than they need to. That's why our government is making it easier and faster for patients to access high-quality care at home. Today's announcement is going to support 850 patients with high complex care needs to get the services they require while expanding virtual care options for patients across the province. Connecting patients with the care they need, when and where they need it, will help keep Ontarians healthy and avoid unnecessary visits and stays at the hospital. This program will help ensure Ontario's hospitals have the capacity needed to address the ongoing effects of the COVID-19 pandemic and help end hallway health care. It will also add approximately 484,000 nursing and therapy visits and approximately 1.4 million personal support worker hours. This could mean up to 11 hours a day of personal support services and nursing services per patient. In addition, our government is also investing $14.5 million to support the expansion of virtual care for Ontario health teams and frontline home and community care service providers. We have seen a significant increase in the number of visits provided virtually across the province. To support this growth, especially during the pandemic, our government is providing additional support to sustain virtual care capacity and to improve quality. This investment will help purchase new technology for video conferencing, remote monitoring, and secure messaging that will enable care to continue to be delivered at home, minimizing face-to-face visits where appropriate, and keeping clients and families out of hospital. It will also go towards remote patient care, monitoring, and symptom management at home to support COVID-19 patients and other vulnerable populations. This will allow patients to connect virtually with a healthcare provider for routine checkups, symptom monitoring, referral to other providers, and, when necessary, access a virtual or in-person medical assessment. Our government believes in offering more choices to patients receiving care. We also believe in making healthcare simpler, easier, and more convenient for patients, while allowing patients to continue accessing the routine healthcare services that they need throughout the pandemic. Today's investment is all part of our commitment to make the health and well-being of Ontarians our top priority during these truly unprecedented times. Thank you.
We'll go to the phone line for questions.
Great. Just actually, Ellie, before we start the questions, I just want to thank people for giving me a call and messages yesterday. You know, I zapped my back out. I don't know if you've ever had a back pain, but man, I'll tell you, that brought me to my knees yesterday. And, you know, we've been going every day. The only thing I'm disappointed is that was my first press conference I think I missed since the beginning, so I apologize for that. But I'm back at it today, and we're going to keep going. But just want to give a shout out and thank people for their messages. But I'm good. I'm healthy as a horse right now. Well, not really healthy, as I probably look like a horse, but not as healthy as one. But anyways, go ahead.
Over to the operator for the first question, please.
First question comes from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Welcome back. Glad you're feeling better.
Thank you.
I just wanted to ask about the letter yesterday from the group of 50 retailers.
Yeah.
They're asking you to essentially revamp your essential business plan. They say that it's actually made the situation worse because shoppers are crowding into the big box stores in Toronto and Peel. They're flocking to York, and they're asking if you're open to opening non-essential retail in lockdown stores at 25% capacity. What do you make of this?
Well, I understand, you know, they want to open it up. And I keep saying that my heart breaks for these folks. We put $600 million up front to support them. We're paying with support from the feds, 90% of their rent, 65% of the wages. The province is taking care of all their tax bills, their hydro, their electricity, their gas bills, just to keep them going. But I understand. I really do, Laura, and I'll do anything I can to help them. As much as I'd love to say, yes, people have this misunderstanding. I can just go out there and change everything. Well, ultimately, I guess the cabinet can, or I can, but man, I can't do that. I have to follow the advice of the chief medical officer. But in saying that, I'll pass it over to the Minister of Health.
Well, it certainly is a very difficult decision to make to put certain regions into lockdown because we know that there's going to be very devastating effects for many small businesses that won't be able to keep their stores open. They can provide goods for pickup, but we know that will have a significant impact on their bottom line. But ultimately, it has to come down to the health and well-being of the people of Ontario, that we can't have a strong economy if we don't have strong and healthy people in the province. And so we've always said we're putting the health and well-being at the top of everything that we do. We are taking recommendations, of course, from the Chief Medical Officer of Health and the Public Health Measures Table and Public Health Ontario and many others who stand behind them. But there was a report that was just released today by York University that takes a look at what happens when you do these sorts of lockdowns. What kind of an effect does that have on reducing community transmission of COVID-19? And there is an impact. It does make a difference. It does help to reduce the numbers. It has helped to bend that curve. That's what we really need to do to make sure that we can have the hospital space, the public health space in order to test, trace, and contact manage all of the people that are coming down with COVID. So as difficult as it is, there certainly is evidence now that that these measures do produce the effect that we want to see, which is reducing transmission.
Follow up?
And Premier, I wanted to hear your thoughts, and Minister Elliott as well, on comments that the Minister made today about Ontario not being in crisis in hospitals, but have you taken a look at Alberta? We know that some hospitals in Ontario are strained. So I'm wondering, Minister, why you would make such a comparison. And Premier, perhaps you can share your thoughts on how you think Alberta has handled the crisis. We've seen the numbers and we've heard the stories about the ICU and hospital capacity. Do you think that Premier Kenney waited too long to act?
Well, I'm not going to pass judgment on Premier Kenney. Number one, full disclosure, he's a friend. He's a great ally, and I think he's a great premier. Everyone has their decisions to make. His province is much different than ours. It's probably 1/4 the size of ours, and I guess the numbers will speak for themselves. If they're going up, maybe it wasn't the right decision, or going down, maybe it was the right decision. So I'm not going to judge Premier Kenney, but I'll pass it over to the Minister.
Well, there's no question that many Ontario hospitals are under stress right now, particularly in the lockdown areas. I know Scarborough General Hospital is having a difficult time, is having to not do the number of volumes of tests and procedures and surgeries that were postponed during Wave 1. I believe William Osler is also in the same situation, and there are other hospitals. But to say that they're in crisis is not the case. Alberta is in crisis when you have to have double cohorts in a single intensive care room. That's a crisis. We are not at that stage in Ontario, and we have built capacity purposely knowing that we were going to have an increase in the number of COVID cases in the fall, as well as trying to keep those other surgeries and procedures going. So there's more that we need to work on, but we're in regular contact with the Ontario Hospital Association. We're in contact with the hospitals that are experiencing these sorts of stresses. And what we're really trying to do in dealing with that backlog of surgeries and procedures is take a more regional look at it, so that if there is one hospital that might not be able to deal with those volumes of surgeries and procedures, but there's another hospital in the same region that's able to do that, we want to be able to continue that process as much as possible, because we know those are significant, very important surgeries as well. So we have built the capacity, we've built the numbers, we have rooms for people, we have the ventilators if people need them. We are ready for any other surges, but that's why we're doing the lockdowns in some areas, imposing control measures in others, so that we can try and bend that curve and try and get those numbers down. So it all has to work together, and that's what we're doing here in Ontario.
Next question.
Next question comes from Lorenda Redikoff at CBC News. Please go ahead.
Hi, how you doing?
Hi there, Premier. It's been recommended by the National Advisory Committee on Vaccines that essential workers in jobs outside hospitals, like grocery store workers, cab and bus drivers, that they be one of the first groups to be vaccinated after the healthcare workers and the elderly. How are you going to make sure that this happens for these workers? Some of them are in the lower paid levels of the workforce.
Yeah, well, our goal, and I'm going to pass it to the Minister of Health in a second here, but our goal is to make sure that all frontline healthcare workers, long-term care workers, rural, northern, Indigenous communities get taken care of. And then I wouldn't disagree with those comments. You know, I think they're great comments, but that's going to be up to the task force and General Hillier and the Minister of Health to put that list together.
Well, we are considering all of those issues as part of the vaccine task force chaired by General Hillier, and there will be people with all levels of public health experience, people who are knowledgeable with epidemiology, people who are good in IT, but there's also going to be a bioethicist that's going to be involved in that to make sure that the choices that are made as to who gets the first vaccines are made fairly and equitably. And there's no question that our most vulnerable will be among them, our residents in long-term care homes and other congregate settings, frontline healthcare workers, because we need them to be healthy to take care of all of the rest of us to achieve a healthy status. But we will have the necessary people there to make sure that we use the appropriate rigor to make sure that we are making these decisions equitably and fairly.
Follow up?
We've heard the recommendation for field hospitals. Often the suggestion has been that, you know, that they be just outside long-term care homes as a way to get the elderly who are most at risk out of those 3 and 4 bed rooms. This has come from, I've heard it from a doctor, and then this morning it came up in question period from the opposition. Is this something you're considering?
Yes, we are. And we have a great field hospital in Windsor right now. It's they're doing a great job, but definitely we're looking at it. We're considering it. I'll pass it to the Minister of Health.
We are looking at a variety of locations, including field hospitals, as the Premier's just mentioned. We're looking at the best place to move residents of long-term care homes or people that require places to live if they have to move out of their homes, the long-term care homes that they're in. But it has to be appropriate, it has to be safe, it has to be culturally appropriate for them as well. So we are examining all of those issues with the Minister of Long-Term Care. She is spending her full time and attention on this issue because we want to make sure it's safe, comfortable, and appropriate for them.
Next question.
Next question comes from Lucas Meyer at News Talk 1010. Please go ahead.
How you doing, Lucas?
Thank you very much. Happy to hear you're back feeling better, Premier.
Thank you.
On businesses, I know you said before it would be a logistical nightmare to cordon off non-essential items in stores, but it's already happening in some jurisdictions, and stores close off sections during parts of the year anyway. So just in the spirit of fairness to those smaller businesses selling the same items, if you're not going to allow them to reopen to in-store, have you considered just putting this on the bigger retailers? You know, close up, tape off stuff that smaller businesses can't sell, and then open up when they can.
Yeah, I've had this discussion, and I'll answer this, and I'll pass it over to the Minister of Health on the health side. But what the health table's trying to do is limit the amount of visits that you're out there. So I'll give you an example. If you're going to one of the big box retailers, it's kind of the one-stop shop, and I know it's not fair, believe me. I know it's not fair, but it really limits people from going out and making 4 or 5, 6 stops on the way home to pick stuff up. And I've always said, for everyone out there that is out there, maybe really, I've had some protesters out there. Go online, shop online, order meals online, do everything online, and not with the big online retailers as well. Call the store up if they don't have a website. Call them up and order something online and get it delivered or do curbside pickup. And as for, I'm not going to get deep into the supply chain and everything, but it just doesn't work that easily with these big box stores on supply chains and leaving cargo sitting on the docks, the ports, and it just is not realistic. So I'll pass it over to the Minister of Health.
Well, yes, the reason for some of the small businesses closing in some of the lockdown areas is because it's really important not to have numerous contacts if people are going from shop to shop and so on. It's just more opportunities for the virus to be transmitted. And you're right, with respect to the big box stores, we're hopeful that people will go in there for essential goods. That's the reason why they're open, for the pharmacies and some of the grocery sections that many of the big box stores have. And we're really asking people to please support your small, from some of the Amazon and some of the other big organizations. Please continue. Order from small businesses, order from your local businesses in your communities if you're in lockdown. And that will help them get through this as well, because you can still order and go and pick up your orders. That's what's happening in many malls. It's happening in other businesses. But please support your small businesses, and please support your local restaurants as well with takeout orders.
Follow up?
Thank you. And switching gears a bit, Premier, on the Auditor General, the Star had quite an interesting investigative piece on the office this week, detailing staff feeling pressure to come into the office despite public health concerns, pressure to use vacation days, strife over office work exemptions, intimidation, etc. And it kind of posed the question in the piece of who's watching the watchdog. I recognize it's an independent office. I get that. But the Integrity Commissioner can't look into this type of complaint. So, I mean, what's your general reaction to hearing that type of internal concern within the office? And do you think that 10-year terms for this type of position is too long?
Well, I'll start off with the 10-year terms with anyone. I think it's too long. I'll even speak for myself. I think 10 years is too long for a premier, to be very frank with you. You need to have fresh blood in there and moving things along after a certain period of time. That's just been my opinion right from day one, and I know a lot of companies do that. They move things along after a certain period of time, but I'm not going to interfere with the Auditor General's office. But I can tell you this: everyone has to be held accountable. There's no one in this province should not have someone that they report into, or there's some sort of accountability at some level. I'm accountable to 14.5 million people and media and everyone every single day. So, you know, I think everyone has to be held accountable one way or another. I don't have the answer for that. I'm just saying I think most people feel the same way, that everyone needs to have some sort of accountability.
Next question.
Next question comes from Richard Southern at 680 News. Please go ahead.
Hi, Richard.
Hi, Premier. Just circling back to that letter you received from retailers, some of the biggest name retailers in Ontario. One of the points they brought up was that they felt shoppers were being funneled into increasingly crowded stores, and they felt that was becoming a health risk. I'm wondering, Premier, do you think those retailers are right or wrong on that point?
Well, I'm not going to knock those retailers. They're great retailers, and I'm glad they're here in Ontario. But the other big box stores are at 50% capacity. So I know we have folks going in there checking to see if they're meeting the 50% capacity. I just got to tell you, I always have to listen to the Chief Medical Officer of Health. I put my business hat on. I'd switch those things open in a heartbeat, but I can't. I have to listen to the health experts. It's proven. It works. And that's how we've been able to move forward this whole time. You know, I'm a business person. I don't want to close these down, but health trumps my personal belief of doing something. If I didn't listen to health throughout this whole pandemic, we'd be in so deep we'd be under the water big time. And I always will listen to them. I promise you that. I always will listen to them. Do we try to push them a little bit? Yeah, we do, but that's healthy. You have to do that. And I just got to give a shout out to our health team. They're phenomenal. I got to give a shout out to all the docs and the nurses out there. They're incredible. And even when I talk to docs who are not on my health team, they're telling me the same thing. You know, my doc, when I went to go get checked out my back, he says, you're doing the right thing. I know you're getting a little bit of flack kicked back on small businesses, but I can assure the small businesses, I do not want to do it. I have to follow health and the guidance of health. It's a priority, but I'll pass it to the Minister of Health.
Well, it does have to be a priority. We are fortunate in this sense, if there can be anything fortunate about COVID, that Ontario still has the lowest number of cases per 100,000 in all of Canada, in fact, in all of North America, except for the territories and the Atlantic bubble. So something is happening right, and I give great credit to Dr. Williams, our Chief Medical Officer of Health, the Ministry of Health people, Public Health Ontario, Public Health Measures Table. They have guided us in the right direction. It's not without challenge, though. We recognize that. We know that there are many businesses that are suffering, but health has to be number one, because we won't have a booming economy if we don't have healthy people here in Ontario. So we need to keep moving forward with it. As to some of the other larger stores being overcrowded, they are open at 50% capacity. And there are people that are checking on that because, again, you don't want too many people around in an inside space. That aids community transmission as well. So those boundaries must be adhered to as well.
Last question.
Last question.
Thank you. Premier.
Yes.
Sorry, Premier, just on another matter, if I may. We heard from the Prime Minister yesterday. He said the Canada-U.S. border restrictions will likely remain in place until the COVID situation is under control globally. Obviously, that's going to be some time. But we know you can still fly between Toronto and the U.S., almost hourly. There are flights to and from Pearson. Do you think more needs to be done to restrict travel between Canada and the United States with this COVID situation getting worse down there, sir?
Well, I think we need guidelines. I'm in full support of keeping that border closed to the best of our ability outside of, the retail and businesses flow going back and forth, goods and services. But so we're working with the federal government right now at Toronto Pearson to reduce the downtime. Once you come back, you have to quarantine for 14 days. We want to knock that down. similar to what they're doing out in Alberta. They're doing a trial. We're doing a trial, and I was asking about that this morning. Funny you ask. I said, where are we at on the trial over at Pearson? So I'll have an answer this afternoon on that, but I'm really pushing it, because if you can land, you can get tested right away, and then you get tested again. I think it's 5 to 7 days later, and they both come out negative tests. You should be able to go on your way. You shouldn't be having to stay locked down for 7 days. So I'm really pushing that. And what I've always recommended, and I say it all the time from the beginning of this pandemic, we need to, the feds, they need to step it up, at least take people's temperatures when they come in. Do something. Don't just let them walk off and hop in a taxi and away they go. And because there are certain people that you're supposed to quarantine. I'm sure a lot do, but I'm sure there's a lot of people that don't quarantine either. And I'd almost guarantee it. So let's take people's temperatures. Let's, I'd even like to do a voluntary test for people. They're coming in. Let's have people lined up and do the test. And it just really keeps our communities safe and Ontario safe if we do that. But that's not my jurisdiction. That's the federal jurisdiction. So we're going to keep doing everything we can to get this this rapid test happening.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob. How are you doing?
Hello, Premier. I just wanted to ask the Health Minister a question. Minister, today in question period, you were saying that Ontario was flattening the curve, and I'm wondering, did you misspeak or what's up with that? Because we've plateaued at 1,700 cases, which is a day for 6 days, which I'm sure is not a level you like, and we keep hitting new highs every day in the 7-day average of new cases, as well as the number of active cases, which is almost 15,000.
Yes. Well, we've plateaued at a very high level, but what we want to do is keep it there, but move it down, not go up anymore. And we are several weeks into the lockdown period. We should be able to see very quickly in the next week what the results are of the lockdown and what results it's having in bending that curve and getting it to go lower. That's what we all want to see. We did see it go up just shortly after it got put into lockdown, largely because of some events that had taken place in certain communities and people getting together in closer groups than what we'd like to see. So we're going to continue to follow it very closely, but we certainly don't want to get to the level that some other jurisdictions have seen. So we're going to be following it.
Follow up, and this will be the last question.
And given the concerns we're hearing from, down in Windsor and Kitchener-Waterloo about hospitals and cases and whatnot, can you say at this point how many regions are tracking to move up the ladder of the color-coded control zones, the color-coded zones? Do we have any municipalities looking at they're going to have to go into lockdown or more going into the red zone?
Well, we do have discussions about that. The Tuesday evening data is reviewed and consideration is given to what might happen. But what's happening with that now is that Dr. Williams is speaking with the medical officers of health in several other areas to obtain their views about whether they want to remain where they are, whether they think they should move up from orange to red or into lockdown. And that's something that won't be finalized until those discussions have been held and until the Thursday evening results come in as well. So that will be something that we will need to consider at that point to determine whether any group or area needs to move into another location. So thank you.
Thanks, everyone.
Thank you, everyone.